Hello, everybody, and welcome to the show. I'm very, very happy today to let you all meet this fine woman physician that I have known, I think, since you opened your practice. It's Dr. Nair of Envision Direct Primary Care. Welcome to the show.
Thank you so much for having me, Sharon. It's been a pleasure knowing you.
It's so great to know you for more reasons than one, and I can't wait to talk about direct primary care with you. But I first want to talk about your singing. You have no idea, everybody. If you want to hear some beautiful singing, I would highly recommend that you bring this up to Dr. Nair the next time you visit, or maybe go on her Facebook page, because you have a beautiful, beautiful singing voice.
Oh, thank you. I do believe that my voice is good, but I do not consider myself a great singer at all. I mean, I'm in the beginner level. Eventually, sometime I would definitely like to take official singing lessons, but music is something that brings a lot of peace to my soul.
Oh, it's so beautiful to listen to. I've enjoyed it so much, and watching the joy and the love that you have for your family. You're very transparent and honest, and it really, really, it touches the heart every time I see it. So I wanted to make sure I said that first.
That is so sweet, Sharon. Thank you.
You're welcome. So I'm very happy to have this conversation, because I have been talking about direct primary care and I've been recommending you. I love so many things. Number one, I love that you are a female physician who is a board certified internal med doc that broke out of the chains and said, I'm going to do this on my own. And I know it's going to be tough in the beginning, but I'm going to put my best foot forward and do this, because you realize it's so necessary. And I want to get into the nitty gritty and ask you some questions so the audience understands exactly what it is direct primary care is and what your practice provides. But could you first just tell the audience your why you decided to not join, stay in the hospital organization? Not that there's anything wrong with that, but go out on your own.
Absolutely. So before starting my own practice, I was working for one of the local practices wherein essentially I was working for the big shot insurance companies like Humana, Optimum, and things like that. And it was at that time that I really realized how much hold the insurance companies had over the practice of medicine. And I could see that that was not something that I wanted to do for a very long period in my life. 20, 30 years from now, when I retire, I wanted to be able to have had that career satisfaction. And as a physician, I do believe that career satisfaction in medicine is directly proportional to the quality of relationship that you share with your patients. And the only way to improve that quality was by breaking out of the system, cutting out the red tape, and giving patients time and getting to know the patients beyond their diagnosis. And hence I started my own practice, which is direct primary care model that allows me to do just that.
Okay, great. So now I want to really break it down of what direct primary care actually is. So we chatted a few minutes before we got started today, and I told you that I have friends and colleagues that do stay in their jobs based solely upon their health insurance, which I completely understand. I realize the great fear of stepping out and not having this, insurance plan. There's really the days of employers paying 100% towards your insurance plan are gone. You're contributing no matter what. And you, I'm so grateful that you were able to say the word that I've been searching for, catastrophe coverage. So
Yes.
break down catastrophe coverage and what your practice provides so people can understand the value of joining a direct primary care practice such as yours.
Absolutely. So direct primary care is just that. You have a physician who knows you well, who knows your medical conditions well, and who will be there for you. Okay, whether it is managing your chronic medical conditions or emphasizing on your preventative medicine so that we can prevent urgent care, emergency room for primary care concerns. Having said that, direct primary care is not a replacement for insurance. You still need catastrophic coverage. So when I say catastrophic coverage, it means you need insurance coverage for hospitalizations, for any unforeseen events such as surgery or something like that. So when you combine your direct primary care membership with a catastrophic plan, you are coming out way ahead. You are saving money because number one, you are keeping your primary care expenses very predictable. That is, you are paying for the annual membership, and beyond that, you are not paying any additional co-pays. You are not paying for, for example, if I'm getting an EKG done at my office, you are not paying anything additional for the EKG. Or if we are getting a breathing test done, you're not paying anything additional. So basically, you have the peace of mind with direct primary care that, okay, I am paying this annual membership, and with that, I am covered for my primary care needs. But should you need hospitalization or ER visits, things like that, your catastrophic insurance can take care of. So it's a complete, in my opinion, it is the most cost effective plan for healthcare coverage. I cannot hear you.
Yeah, we've had some technical difficulties, but we're back. So, such as life in 2021 too, not just 2020. But I love this breakdown. And I remember when we first met, you gave me this price list that I was like, oh my God, this is so wonderful, because it's very scary for somebody to think, oh, I have to go and get an MRI. I have to go and I have to get x-rays. It's overwhelming to think, how am I going to pay out of pocket for this expense? So, and also with prescriptions, you have the ability to prescribe and then have patients fill their prescriptions right there in your office, right?
That is correct. I do have a dispensing license, which means I can dispense medications from my practice. Yes.
Yeah. So, all right. So let's talk about the other benefits that people have coming to direct primary care. So you offer, first of all, I love that you're all about preventative medicine.
Yes, absolutely. That is big in my practice.
Big. We would prefer not to treat the chronic disease, but to actually practice prevention, correct?
That is absolutely correct.
Yeah. So you offer telemedicine.
Yes,
You offer same and next day appointments.
that is correct.
If a patient here in the world of 2021 wants to pull out their phone and text you, that is possible.
Yep, absolutely correct.
Sold. So, all right, let's talk a little bit about preventative medicine for a moment, because you are board certified internal med physician. And as we know, when you are in this structure of like the insurance model, you really are treating more chronic disease versus having the time to spend to talk to somebody about their nutrition, exercise. So why don't you talk a little bit about your passion behind prevention?
Yeah, absolutely. So, in a conventional medical practice, the physicians are taking care of anywhere from 3,000 to 4,000 patients. Whereas at my practice, I limit my practice panel to a couple of hundreds. So, this allows me to really focus on individual patients and their healthcare needs. So, appointment times at my practice are anywhere from 30 to 60 minutes. So during that time, I am able to really know a lot more about my patients than their diagnosis. I am able to know their lifestyle factors. I am able to know their family relationships. I am able to gauge more into their mental health and things like that, because our health is a multi-dimensional thing, right? Everything, our lifestyle factors, our diet, nutrition, our exercise, relationships, everything plays a very important role in our overall wellness. So I am able to gauge all that, and I am able to provide my insights for cater towards the overall wellness of my patients. Sometimes it may be something as simple as getting the patient for therapy or giving the patients a guide into avoiding this, and this in their diet. Or it could be more of a preventative medicine per se, wherein I am telling them these are some of the tests that I think we should go ahead and get done to see where you stand from a baseline.
So, in line with prevention, what do you practice for yourself in terms of preventative medicine besides singing?
Great question. I feel that, especially as a woman, it is extremely essential to fill our own well completely so that we are able to take care of individuals who are depending on us. And it can include our husband, our other relatives, our pets. We as women tend to have a lot on our plate. So I try my best to take some time out for myself to do the things that I really enjoy. And some of them are, as you know already, listening to meaningful songs with wonderful lyrics and singing them, or sometimes just sitting in my backyard, sitting alone, journaling. I also like doing yoga, and I am a big fan of Pilates, going for walks. These are the things that I really like doing, and also spending quality time with my husband and my son. I'm not saying that I am able to do this every single time. I do go through these phases wherein, I forget about my self-care, and then I become a little more cognizant about, oh, I need some time to really reset, and I am able to do that. And another thing that I would say is that from a cardiovascular standpoint, I think every woman should engage in some sort of aerobic activity, which could be something like 30 minutes of brisk walking or elliptical or treadmill, things like that, to keep their heart health optimal.
I couldn't agree with you more. So, very happy to hear all of that because we also want to know that whoever we're seeking out to be our primary care physician, that they are practicing what they're preaching, what they're encouraging us to do. So, I always like to know what physicians' own practices in terms of mental, physical, and
Yeah,
spiritual health, because I agree. I think that the integration is also important, more so for women, I think, than men. So,
absolutely.
so there. All right, so let's talk about. I know that you said that you have annual memberships. So is that the only option that you have? Is it somebody pays an upfront? I really want to be transparent with the audience because
Yeah,
I think that's what
absolutely.
everybody's looking for, especially in the world that we're living in today. So can you break that down a little bit for us?
Yes, absolutely. So the annual membership is $1,200 per year. That is where it starts at, and which you can extrapolate to $100 per month. Okay, I do have a preference for annual membership, but in very select situations, I may be able to offer month to month or quarterly payments. And with that, all your visits are covered, whether it is televisits, other modes of virtual visits, emails, text, in office visits. No other additional co-pays or surprise fees.
No surprises. Oh, we love that. Um, so I want to really like hone in on the fact that that's $1,200 a year,
Yeah,
$100 a month. I would say most people spend more money at Starbucks a month,
absolutely.
right? So if we didn't learn anything in 2020, we've all learned as a collective that our health should be the top priority. Our family, our
Absolutely.
health, right?
Yeah.
So there's such a great opportunity to do things differently. And I really do believe that we need a partner in that. We need somebody to keep us accountable. So the fact that somebody could have access to you for an entire year of $1,200, people, let's get with the program. Let's not follow the insurance card anymore. Let's demand better. Knowing that you have somebody who's smiling and actually happy that you're coming, there's another benefit, right?
Absolutely, Sharon. Care at my practice extends beyond your insurance card.
Yeah.
And my patients have insurance, but they choose me because they want to have that relationship with a doctor who knows them well and who will invest the time in getting them better, and hassle free appointments and 30 to 60-minute appointments, which is unheard of in conventional medical practices. So the value is in really having a physician who is like your family.
Yeah. So I want to really also emphasize the fact, because I am thinking about those friends and colleagues that have lost their job, and the thousands upon thousands of people that have lost their businesses, that are unemployed, that are really, really struggling right now. Um, I know that you have special parameters around who can actually pay on a monthly. The preferred method, of course, this is $1,200 a year. I know people that have higher car payments than $1,200. They have it a month. So um, really to discuss that. If you're having a hard time, if you just lost your job, or you're in a job that is affecting your mental, physical, and spiritual health, this is such a great option. So I'm really so happy that we were able to have this discussion today. But before we go, because I know that you have to go see patients, I want to ask you, what did 2020 teach you?
2020 taught me a lot of things. Number one, that anything can happen in life. And the most important thing in life that really is directly proportional to our satisfaction is our resilience. How resilient are we? Because if we are not resilient, then we would be very resistant to change, or resistant to adapting to daily circumstances, and that can cause a lot of mental turmoil. And that is what it has taught me, to be resilient, to mold with the situation.
Yes, move with the flow. I love
Yep.
that word flow, but just being able to, adjust in a healthy manner, So um, I love. I would be remiss too if I didn't talk about, this show is going to air Monday. This is Friday that we are having this conversation. My parents are currently on their way to get the COVID-19 vaccination, which I'm very happy about, because
Yay.
I know
Awesome.
really, really so wonderful. I wish I could be with them, to be honest with you, because they've stayed safe, and they took all the preventative measures of wearing a mask and not being out in public unless they absolutely had to. So, your experience with the pandemic, I want to know first, have you had a lot of cases come into your practice? And also just your thoughts. We don't have to, get into the nitty gritty about the vaccine, but maybe to give people a little bit of hope, because there, of course, like everything else that has gone on in the past year, there's a lot of fear surrounding the
Yeah.
vaccination. What are your
Yeah.
thoughts on that?
So, with respect to your first question about the number of cases, yes, more and more number of my patients are testing positive at this point. Fortunately, nobody has gotten extremely sick, which would have required hospitalizations and things like that. So I am very grateful to God. And the thing is that I am able to guide my patients because they do have direct access to me, and we are able to prevent things from progressing or worsening because of the level of relationship that we share. To answer your second question, my husband and I have already gotten our first shot of Moderna vaccine, so we are so happy about it. And I would encourage all of you, the general population, to get your vaccination when it is your turn. And right now, 65 and older are able to get their vaccination, so please do so. This vaccine is not a vaccine which is using inactivated virus or live attenuated, which is a little mellow version of the live virus. That is not what it is using. It is a totally different technology, which is the mRNA or messenger RNA technology, wherein the mRNA codes for a viral spike protein with which it is able to attach to our cells. Okay, so you are not getting injected with the virus. So that is one of the common myths surrounding this virus. And as a result of this, it is quite safe. So I would recommend that you take this vaccine for the peace of your mind, for your health and wellness, so that you can fight through this pandemic, because we have already gone through a lot. And in my opinion, you deserve it.
I agree with you. Have you had any side effects?
So my only side effect was that my arm hurt a lot. So for about 48 hours, I had a lot of trouble even moving it. But I do get that even with flu shot.
Mm-hmm.
So I don't think it was anything. Well, it was a tad bit worse than flu shot for me, but that's about it. And for my husband, he did not even have that issue.
Interesting. Well, I've heard the same feedback from other physicians that have had their shots, really just a pain in their arm. So
Yeah.
I think that the grand scheme of things, a little pain in the arm is certainly worth not contracting this virus if you can forego that. I had it myself back in July. My husband had it. We were, thank goodness, very healthy, and we've known many people that have gotten it that have been okay, but especially for our elderly community, if we could just continue to stay safe, wear our masks, socially distance, even when you have the shot, listen to the professionals. And again, I'm so grateful that you have this practice available to us. You're located in Palm Harbor, which is here in Tampa Bay. For anybody that's listening outside of the Tampa Bay area, sorry about your luck, but you do have telemedicine. So we could always think about that for the future. So thank you so much for joining us today, Doctor. I appreciate you.
It has been such a pleasure, Sharon. Thank you so much for having me.
Thank you. Don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.